Knock, knock, knock. Hi, my name is Julia. I'm going to be your student nurse for today. I'm going to perform hand hygiene, and I'm going to provide privacy. Alrighty, I'm going to look at my orders, and the doctor has ordered me to take your vital signs to a respiratory and cardiac assessment. Is it alright if I grab your name for a second? Can you verify your name and date of birth?
Olivia Captain, 02-15-2002.
Alrighty. And is it alright if I can touch you in any sort of way during this assessment? Alright, so the first thing we're going to do is your blood pressure. Okay. Alright. Sorry if we do it on the left arm. Okay. Just going to pull up your sleeve like that. Is that too tight? Okay. Alrighty. Just going to stick this on your sleeve. Just a little bit. There we go. That's better. All right. I got 118/70, which is within normal range. And next I'm going to take your pulse and respirations. Alrighty, get my timer set up. Okay. Okay. And your pulse was 72 and your respirations were 14. And those are both within normal range. All right, so now, are you in any sort of pain today?
Yeah, my lower back is like killing me.
Okay. And on a scale of 1 to 10, how would you rate that pain?
About a 8.5.
8.5, okay. And what kind of pain is it? Is it an aching, a dull, a throbbing kind of pain?
It's like a piercing pain.
Piercing pain? Okay. And when does this pain occur?
Like as soon as I wake up in the morning.
Okay, so it happens all day as long as you're awake. Okay, and how long has this been going on?
For a couple weeks now.
Okay, and does this affect you being able to do anything of your daily living, or?
It gets in the way of like work and stuff. I stand all day for like 8 or 10 hours. I'm a barista, so it's really hard on my back.
Yeah, that definitely will make it worse. So a good thing to do is to have really good shoes with soles that can help your back as well. Alrighty, and have you been having any trouble breathing?
No.
Okay, any chest pain? Okay, have you had COVID recently or anything? Okay, alright, so I'm going to move to the respiratory assessment. Alrighty. And we already did your respirations, but I'm going to listen to your lung sounds, okay? Is that right? Okay, if you can just move your hair, if I can move it. There we go. Alright, I'm going to start on the upper left. If you could just take a deep breath for me and exhale. Okay. And if you could take another deep breath for me. This is the right upper one. Alrighty. And if you could just lift up the breast for me for a second. Okay. Okay, just take another deep breath. Another deep breath. Alrighty, yeah, we'll listen to these sides real quick. So if you could just lift up your arm. Alright, and take a deep breath for me. Okay, take another deep breath for me. Okay, and then I'm going to listen to the back, so I'm going to have you lean forward a little bit. I'm going to move your hair. Alrighty, again, I'm going to just lift up your look. Take a deep breath. Take another deep breath. Alrighty, and the right roll, another deep breath.
Oh, yawning. Hold on.
It's okay. Okay, and the left roll. Alrighty. Alright, there's nothing that sounds abnormal for your breathing. Alright, next thing I'm going to do is I'm going to educate you on turn, cough, and deep breath and the incentive spirometer. So I have this right here. This is your incentive spirometer, and you're going to inhale into this 10 times in an hour, so or every commercial break. So what I'm going to have you do is I'm going to have you hold this and just inhale for me. Okay, awesome, and you're done. And then you do that 10 times every hour, and then or every commercial break. And then also I'm going to educate you on turn, cough, and deep breath. So if you would just turn, cough, and take a deep breath for me. And that's just kind of clearing out your lungs, okay? Alright, have you had any sputum or anything lately?
What is sputum?
Like mucus in your throat?
No.
Yeah, okay, good. Alrighty. And now we're going to move on to your cardiac assessment. So the first thing we're going to do is assess for some JVD. So I'm going to move your hair again. Sorry, I keep moving it. Alright, and if you could just tilt your head a little bit for me. Alright, don't see any pulsing. Let me turn to the other side for me. Alright, no pulsing. Alright, the next thing I'm going to do is I'm going to palpate your pulses. So just see your radial pulses real quick. Okay. They're both even, and I would say they're about a +2 strength. Alright, I'm going to move down to your feet, okay? So I'm going to do your posterior tibial next. Okay, I'm going to say those are also good. They're about a +2 in strength. And I'm going to do dorsalis pedis. That's what it's called. Yes. Alrighty, and those are both even as well. Again, they're all about a +2. And then all your other places to take your pulses is your carotid, your axillary, your brachial, your femoral, and your popliteal. I think this is how you say it. Okay? Alright, next thing I'm going to do is I'm going to assess your capillary refills. So if you can just give me your hands. Okay, and there's capillary refill less than 2 to 3 seconds. And then I'm also going to have you, I'm going to assess you for some edema. So I'm just going to hold on your arm. And I will do the same on your legs. And next I'm going to listen for your heart sounds, okay? Alrighty. temperature press for me. Okay, I'm going to do tricuspid. And then mitral. Okay, don't hear any abnormalities. Just remember S1 and S2 sounds. And then if I were looking for any S3, S4 sounds or murmurs, I would turn my stethoscope and listen on the bell side. Alrighty, and I think that is everything. I'm going to get these findings to the doctor. Do you have any questions for me? Alrighty, then you have a good day.
Thank you.